All right. Hello, Optimize
Hi.
You family.
Hi.
I am here with Jessica Matisse today. Jessica, thank you so much for joining us. And we want to talk about a little bit of women's health. But
Great.
before we jump in, introduce yourself. Tell the whole Optimize You family and people on Instagram and social media who you are.
Well, first of all, I'm glad you got my last name correct. It is
Yeah,
Matisse and not Mattis, though I never correct anyone.
there you go. There you go.
Um, no, I've been with Optimize You since 2021. I love saying I was the company's first female owner.
Yes.
I do brag about that often. But no, I love the company clearly and glad to be here.
Yes. Awesome. Awesome. So it's Women's Health Month.
Yes, which is why you're probably talking to me. I'm a female.
Yeah, it's one of the reasons. Absolutely. It's pretty crazy. We talk about this. So this is pretty normal in our lives, right? We
Yeah.
talk about making men and women feel better physically, mentally, sexually. But women, I don't think always take the full physically, mentally, sexually into account. What is, let's just start with what is the biggest thing you're seeing in your office right now, physically, mentally, sexually, women are having troubles with?
The whole list. I think most women for generations have just completely ignored their health because it's not talked about. I think generationally, women do put men first. I can say that. And so
Yeah.
has the medical field. And what we're seeing because of the changes with the FDA and the Menopause Society in 2024 and 2025, it's just become more accepted that women begin to focus on themselves and decide and to identify the weaknesses that they feel. And they also want to feel the way that their spouses feel. And
Right.
so I'm seeing women ask about sex. I'm seeing women openly, in a very safe place, admit that they aren't reaching an orgasm or they're not thinking about sex or they're not dreaming about sex. And sex is a really big topic. I think most women don't feel comfortable talking about. And so I'm talking about it. I love saying sex in my office. It makes people feel really comfortable and awkward at the same time. But that is a big one as well as fatigue. Both of those are really hot topics now.
So ultimately, what you're seeing, and I've seen it as well, is the dismissing of symptoms, right?
Mhm.
Like, hey, like, oh, I don't need to worry about this right now. I don't need to worry about this tomorrow. And then they just dismissed it. So I really love hearing you're not going to dismiss someone's symptoms. You're going to have a really science-based care and talk to them and understand them, right?
Absolutely. Most women are looking for, I wouldn't say an easy fix, but we are all just moving very quickly and they want to feel safe. And most clients up until now have felt very in conflict about choosing themselves first. And when we bring in hormone therapy as a treatment for fatigue, brain fog, sleep, and sex, in past, it has made clients feel very uncomfortable because the other side of that coin would say, no, 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 it
Yeah.
can't be a hormone problem. And what we're saying is it is a hormone problem, and we're able to treat your symptoms perfectly and safely. And it's about cultivating that environment that is science based.
So you're saying that you're actually explaining hormones to these women.
Every day, all day, which is why I have a scratchy voice right now. All I do is talk for a living. But that is the goal when we see clients, and I think that's the expectation company wide is to make clients feel comfortable and to be able to explain why they have heard what they've heard. I say this with like great pride. I very rarely get stumped by something that a client has heard because I'm able to explain why they heard that. The misrepresentation of data or the misrepresentation of bodybuilders.com.
Mhm.
And that is what sets us apart is understanding the finesse of a female body and how their hormones function, but as well being able to explain their questions.
Yeah.
Mm.
So just on the same track for it, you had said something earlier that I'm gonna follow up with, but main sex hormones, right? 3 main sex hormones? Would you throw thyroid in there? What do you love talking about the most?
The sex hormones I would break down into the ovarian system, estradiol, progesterone, and testosterone.
Wait,
Thyroid,
wait, wait, hang on. Women can be on testosterone?
ooh, a lot of it. Yes, yes. Most
Yes.
women
Yeah.
have no idea they create it. And that's from culture. Culture has completely demolished testosterone. It has been Generationally, I would say just since the beginning of time, not even generationally. I talk a lot about generational misrepresentation of hormones. I blame Arnold Schwarzenegger 1,000 times a day for misrepresenting testosterone therapy. And women also create the hormone, just like men create estradiol. Most humans don't understand that we just create hormones differently. Therefore, they have to be managed differently. Women create testosterone. We love testosterone, and it is also a female hormone.
It is. So estrogen, brain, heart, bones, metabolism,
Yeah.
testosterone, energy.
Absolutely. Here's, this is not a good, what's the word, metaphor, but I
Yeah.
often describe the ovarian hormones like a baseball team. They
Mm,
all work together. You can't have a baseball team with just a pitcher because you would lose. Just like
yeah.
you can't have a healthy female with just testosterone or just estradiol or just progesterone. They have to play together. But a pitcher on a baseball team can certainly sub. He can
Mhm.
take over a catcher if the catcher breaks his leg. He won't be able to take over for long and he won't do a good job at it. That's how I describe the ovarian system. Even a full menopausal patient who just chooses to do testosterone because she continues to believe that estradiol is bad will never have the sex she could on
Yeah.
just testosterone alone. Estradiol is one of the main female hormones. And that's, I'm finding myself explaining that a lot to women because she also won't feel good with just estradiol alone. She
Right.
made all three her whole life. They begin to become diminished at different points in her life. Then they need replacing at different points. And then they need altering at different points. Sometimes I make a joke that's why I have a business because we understand the patterns of a female's body. And if a female's always been on one dose forever, she is not living in an optimal balance at all.
So one hormone, so you have three, you have what, over 50 hormones in your bodies, right? We're
Yes.
specifically talking about sexual hormones.
Yep.
One out of whack, it's gonna screw the whole system up.
Absolutely. Yeah.
And then if you're talking to your provider and they're not educating you on estrogen, why taking progesterone with estrogen is important, why taking testosterone with all three could be important for you, you're getting a misservice.
Absolutely. Like, it's like going to the grocery store with a whole list and only leaving with 1 apple.
Right.
Like, you're not gonna be fed for the week. That
Exactly.
is what women have battled their entire life, and even with the legislation changes, they're still battling it. 9 out of 10 women that come to me in a week would say, "Oh, my other provider said I can be on estradiol, but not testosterone. That's
Um,
scary." And then I
um,
hear the complete opposite. "Oh, you can be on testosterone, not estradiol. That's scary." So women who aren't getting the full picture, they're missing out on a very fruitful life.
right. And I'll throw this one at you. How many patients have you had come in, and women I'm talking to you, how many times have you been put on a thyroid medication from a doctor, but they've never looked at your estrogen, progesterone, or testosterone? They throw you on Synthroid, not even on an Armithroid or like a T3, T4 combination. And they come to you and you're like, I just don't feel better. Or they're having to continuously increase my what? My dose, right?
Yeah.
So why do you think doctors are so willing to put people on a thyroid medication very quickly, but then not so willing to put them on progesterone, testosterone?
It's just not an educated system. So this literally began with the Women's Health Initiative when those studies started being produced in the early 2000s. In that study, as the company and the world is talking about at large now, was very skewed, looked
Mm,
at synthetic ovarian hormones, Prempro, Premarin, and the studies began to show those caused harm, and the entire world shut down. As a result of that, they didn't exist,
mm,
period. They were non-existent. There was no research talked about them. Physicians weren't getting educated, nurse practitioners weren't getting educated. It was dead. It is literally like hormones did not exist, and they did. They've always been here, the safe ones. And so I think from a mainstream standpoint, the only hormones that quote unquote existed was thyroid. This is the only one you can have.
right.
It's a complete misguided medical platform.
Yeah.
But that is why we see so many women who have been told, "Oh, it's your thyroid." And I will argue many times it is. When the ovarian system begins to crash, the thyroid system will crash. All of the hormones work together.
Mhm.
You asked a question, did I believe that thyroid was a sexual hormone? I don't think it plays a specific role in sex per se. I don't think it drives orgasms. I don't think it drives the dreams that I think women should have. I don't think it drives this sexual desire that the ovarian system can. I think it drives a feeling. It drives energy and focus, and it alleviates stress. And most women deal with that on a daily basis. We're stressed and we're tired. So if we can treat that stress, if we can bring down that cortisol with an appropriate dose of thyroid, guess what? Happy women, happy sex is what I
Happy
tell. Like, my goal is to treat women to the point where they feel good. And if they feel good, they will want to go home and have sex.
Yeah.
I didn't know this was a sex talk, but I think ultimately a lot of women don't talk about it, and it should be talked about. So we can
Well,
segue.
we do a lot with men, right? And so people
Oh,
that
for
don't know,
sure.
Optimize You started as a men's health thing. That's how we
Oh, I
started.
tell everyone.
Yeah, we
I love
branched.
it.
Yeah, we've really grown, and we really tell people now is you can't have one person in a marriage optimized. They have to
Correct.
both be optimized, right?
Absolutely.
Is that something you deal with a lot when you're dealing with husband and wives and making sure that they're both kind of feeling the direction that they want to be going into that role?
Absolutely. When I see men initially, I always tell them, like, please tell your spouses, what we're doing here so I don't get like angry emails, which has only happened twice. So now I am like very upfront with that information. And what a lot of men don't understand as well is that you can have a high sex drive in the midst of low testosterone.
Yeah,
So they're coming to me and they're like, sex is not the problem, but I'm dealing with everything else. And I'm like, ooh, that's because you have low testosterone. Those men have to be like hyper aware of their sexual drive, because
right.
if they already have a high sex drive in the midst of low testosterone, I love telling patients we can control some of the symptom improvement with dosing, but ultimately there is specific dosing to hit specific symptoms. So their sex drive is going to go up. So please tell the spouse.
Yeah,
And I say the same thing to women. What we don't want is to treat a female sex drive and then her spouse not be treated, and to create an argument there. The goal is that both parties feel the desire at the same time and feel like having sexual encounters at the same time.
yeah.
I'm like a marriage therapist.
There you go. There you go. So we talked about doctors currently in the primary care field, hospital, in that setting. We said, hey, they love thyroid. They put papers on thyroid. What we didn't say is they actually love birth control as well, right?
No,
They'll
we
put
love
a woman on birth control at 10, 11, 12 years old. Is birth control a hormone?
it is a hormone. It's just a synthetic version. And that is where the confusion resides.
Yeah.
I wish that from the beginning of time, everyone in the world separated bioidentical versus synthetic, but that hasn't happened. And so when we hear hormones, we think they're all bad or they're all good. And they're not all good and they're not all bad. And even with the FDA changes that we saw last year, they're still not differentiating them.
Right.
What they're doing is completely ignoring what they said, because I think it's hard for anyone to admit wrong.
Hmm.
So instead of saying, hey guys, we're wrong, now we're saying, hey, hormones are safe, when really we should be differentiating birth control. Those are synthetic hormones and have directly been tied to cancers. And I think if higher medical bodies were to put money into really big literature, we would see women in their 50s and 60s and 70s getting breast cancer. What proportion of those women were on oral birth control and how long? There
Yeah.
likely would be a direct link there.
I think so.
It's not an easy conversation for moms. And so I encourage moms to bring their kids to me. I encourage women of all ages to get lab work and just to have a conversation, because most women are not getting choices. And I
Mm,
think that is where, at least in my clinics, and I know Optimize You as a whole, we believe in choices, but
mm.
people should have the knowledge to decide.
Right.
Do we want to go on birth control? Do we know the harm? Is there another option? And that is what I think sets our company apart. Not every client chooses to jump on a therapy, because we have many,
Lots.
but they will leave informed. And I feel very confident when they leave my consult or my provider's consults, that patient will be informed.
Yeah.
And it's just a powerful gift I think we give.
It's scary to me about these younger women. I have a niece that they just talked about putting on birth control the other day, and I'm like, please no, no, let's talk about it. There's lots of other things that they could talk about and just have conversations. But that's a whole nother podcast. I want to go back to the women themselves and let's
Okay.
really fine tune the symptoms women are having. I want to really pinpoint number one, just give me the top three symptoms women are having when you feel like they need to be coming to see you.
Ugh, mood.
Say that again.
Yeah.
Jessica, give me top 3 symptoms women Jessica, give me 3 symptoms you see most often where you wish the women would have came in just a little bit sooner.
Fatigue that's worsened, moodiness.
Yeah, that's a good one. That should be number 1.
Yeah, it should be. Moodiness is number 1. Moodiness, fatigue, and low sex drive. And the reason is not everyone has every symptom. Not
Right.
everyone, and that is such a big mistake that women are falling into, and not as a fault of their own. Menopause does not mean hot flashes all the time.
Mhm.
Menopause does not mean poor sleep all the time. Menopause does not mean brain fog all the time. Menopause means you have a severe hormone dysregulation that will catch up to you in time.
Mhm.
And I think that's where I'll see women who, I mean, I don't understand. I feel great, but my best friend feels awful, said I should get checked out. And then that female clearly in a dysregulation, whether it be pre-peri, yes, I just made up that diagnosis. It is, it should be. There is a pre-perimenopause, there is a perimenopause, and there is a postmenopause. And in each of those phases, they are treated differently with different dosing. And women who are lucky enough not to have the hot flashes think that they're good and they're not good. Those are the women who get to 60 with cardiovascular disease or cancers
Right.
because they missed a treatment. And moodiness and fatigue is often that first thing that if a female feels off, and a female typically can describe, "Ugh, I feel a little off."
Yeah.
But because of our days, we just push it off when really that is when lab work and subjective data should be collected.
So I've always said women are way more in tune with their bodies than men are. They're way
Yeah.
more. I think it's because they've been dealing with, well, of course, periods their entire life, right? And so they've
Mhm.
been dealing with that shift in hormones from a very young age. I've
Yeah.
always said that. Irregular periods, weight gain, again, brain fog.
Yep.
These are all symptoms, right, that can just come out randomly and it could be different. It could be before your period and after period. You could have different symptoms of what's going on in your body. So working with a provider who can help you adjust your doses is probably important, right? Have you ever given people different doses of progesterone as an example, before
Mhm.
periods versus coming up to a period versus after a period?
Yes, and this is where it literally comes down to understanding the finesse of a female, and which is why I always encourage women and men to go to a hormone specialist because that is what we study. One of the cases that pops out immediately are my postpartum women, my women who have irregular periods, who need to be on progesterone to create an ovulation cycle to get pregnant. Most women don't know that as a pregnant female, your placenta does not take over hormonal control
Mhm.
until around 11 to 13 weeks, which is why women miscarry
Right.
before 11 weeks. If they were given progesterone, the bioidentical one, not synthetic, not Prempro, sorry, Premarin, sorry, Provera, listing all the synthetics here,
Yeah.
giving the oral birth control, oral progesterone will keep that baby in womb. The women who need that typically had symptoms in their teens.
Yeah.
When those women have that baby, those are the women who typically deal with postpartum depression. It is not uncommon that in the first, I would say, 4 months of postpartum, that female has to be on double the dose of progesterone until the body goes back to baseline and then we can go back down to a lower dose. And that's just one example of many where we have to understand as providers it is not one size fits all. It's not one dose for a life. It's not one dose for a season. Another example is a high stress situation where we know cortisol rises. We should consider increasing doses of our hormones, whether it's progesterone, testosterone, thyroid. to support the system during the time of stress,
Right.
which is the benefit of, seeing a specialist.
And you just kind of brought something up there real quick, and mental health. I don't think at this day and age any woman should be on an antidepressant, anxiolytic, without her hormones being looked at first. What's your stance on that? How many women do you come in that have never had their hormones looked at, but they're on Zoloft, Celexa, name 20 more different antidepressants?
I would say 100% of women
Yeah.
come to me on Zoloft, Prozac, who have
Boost
never had
bar, right? Boost bar.
Yes, who have never had their hormones evaluated, and that's because they're in mainstream, and the hormone culture is changing. I often say it, and I don't even know baseball. I don't know why I talk about it so much. Um, if the hormone culture were a baseball inning, we would be in the first inning. Look 20 years down the line, thyroid therapy, high dose thyroid. Actually, I shouldn't even say high dose thyroid, appropriate dose
Right.
thyroid, appropriate dose testosterone will treat depression. We will not be looking towards Zoloft being our first one, which makes people feel really uncomfortable, like Jessica. But it's about understanding health and wellness. We should be using our natural hormones because what we know is they're deficient. It's foolish to think they're not. I often talk about we all agree that our environment is worse, our air is worse, our water is worse, yet no one is looking at hormones and changing what should be considered normal. So there is a realm where 90% of my women and men, but because it's Women's Health Month,
Mhm.
90% of women can come off their antidepressant if they're willing to accept literature.
Yeah.
And that
And so we're
literature,
not women, we're not saying come off of your antidepressant today. What we're
don't do
saying
it.
is
Don't do it.
come see a provider. If you are on an antidepressant, anxiolytic, Celexa, Zoloft, and again, all those others, stop in and optimize you and really let's take a look. What's going on
Yeah,
with your body? Is there something we can change where you don't have to be on an extra medication? We just use a
absolutely.
hormone, right?
And I
Last
think,
thing I want to talk about real quick.
yes.
So GLPs are massive right now. Massive, massive, massive. So many women are on GLPs. I see GLPs just like your antidepressants. I want to look at your hormones before putting somebody on a GLP. What I've seen is that hormones, if you're on a GLP, they'll work with your hormones screwed up, but they'll work really, really well with your hormones fixed. Have you
Mhm.
seen this in practice? Do you recommend kind of getting a lab panel and looking at everything before being on a GLP?
Ooh, tough question. I love
Mhm,
GLP so much.
mhm.
I do agree though, because, and here's a scenario. When we're dealing with PCOS, polycystic ovarian syndrome,
Which
when
is
we're,
massive.
yes, which every female has, I would argue, when we're dealing with peri, or menopause, we're still going to have success with weight loss with a GLP-1. You're just not going to have as great of success if we treat your hormones as well, because you're fighting against a brick wall.
Right.
Long-term success means hormone regulation, and there are specific levels we can look at, LH and FSH being one of them, that would help us depict and show hormone regulation. I try not to tell people what to do, but I love telling people what to do, and they leave with, like, very clear direction. If you have PCOS and we're not treating your hormones, I'm still going to give you a GLP-1 because I love them, but you will be back to me because you
Right.
will need your hormones regulated. And I would say the same to my menopausal women as well.
Yes. Well, thank you, Jessica.
You're welcome. So
Thank
fun.
you. Yeah, thank you, and, helping optimize you, help women feel better mentally, physically, and sexually. We want
Always.
women to feel better, right? If you're
Yes.
on an anxiolytic, if you're on an antidepressant, if you start a GLP and maybe you're not getting the results you wanted because you haven't had your hormones looked at, stop in and see Jessica if you're in the Louisville market, any one of our Optimize U's, and, thank you all. Thank you, Jessica.
Yeah. Thank you. Talk to you guys soon.